Well, this morning we are learning more about what happens when people start reducing the frequency of weight loss drugs. I'm now joined by Scripps Clinic obesity and internal and medicine specialist, Dr. Mitch Biermann, to discuss the new findings of this study. Doctor, thanks for coming in here.
Thank you so much, Eric. It's a pleasure
We
to
hear
be here.
about Wegovy, Ozempic, a lot of people using these, and they're losing weight, which is great, right? Talk about the benefits of that, and then we'll get into this study.
Yeah, so weight and obesity has many complications on the body. We're talking about increased risk for heart attacks, strokes, 14 different cancers. So any medicine we have to help dial down weight is going to be beneficial for many aspects of health.
Yeah, and a lot of people have been coming in asking for these specific drugs, and what has been kind of the results for them, and what have been some of their concerns?
So in terms of results, we have really good data showing that there's a reduction in heart attacks, in kidney disease, sleep apnea, and then many components of metabolic syndrome, so like high cholesterol, high blood pressure. We don't have data yet on cancer. We want to see, that'll take much longer in terms of studies, but we're hoping those obesity-linked cancers go down too over time. Sure. That's been the case with bariatric surgery. That's been shown to reduce cancer risk.
Okay. I know some of the concerns are the cost is very expensive. What is the average cost, and what are some of the concerns you're hearing?
So it's come down a lot. When these medicines started, it was about $1,500 a month.
Wow, okay.
Now it's down to more like, depending on the drug and the dose, $300 to $500 a month.
And does that matter whether you have insurance or not?
It does. So these, I'm giving you quotes for prices out of insurance, right? Which unfortunately is the situation for many patients.
Sure.
But if your insurance covers it, it can be like any drug. It can be like $30 a month, something like that.
So when people lose the weight that they want to, they have maybe a healthy goal they want to get to, then maybe it's time to wean back a little bit because the costs are adding up.
Yeah.
That's where this study comes into play, right? Can you walk us through that?
Yeah, and actually, even before people lose the weight, the number one patient hesitancy factor I get is, do I have to take this forever? Do I take this every week forever? And that's one of patients' main reasons to not be on the drug in the first place. I originally when patients would ask me this question, the only data we had was from pharmaceutical companies basically studying taking people off cold turkey and seeing what happened. And most people in those studies regained most of the weight they lost.
Oh, really? Okay.
But I noticed some patients were coming to me telling me, I'm only taking this every other week and I'm maintaining their weight. Once I heard the third or fourth patient telling me that, I started recommending it to other patients, and then I started recording and analyzing the data.
Oh, interesting.
And once I got to like 30 or 40 patients who were doing that and basically on average maintaining their weight, I started recommending it to everybody, and I published it. Okay,
and what are the findings then that you can just start to wean off? How much? Like what are you recommending?
I usually recommend if people, whatever dose people are at and getting a good weight loss result and doing it every week, I just have them do every other week.
Oh, okay.
And patients then tell me different things. Some people tell me they're using it like every 2 months even.
Oh,
Those
really?
people tend to exercise a lot. And I would say that is one of the biggest things. No matter how you lose weight, exercise is the number one protective factor against regaining it.
Okay.
Which is a paradox because exercise doesn't cause people to lose a bunch of weight initially.
Sure.
But it is the number one thing to prevent gaining it back.
Okay, so it can reduce the cost a little bit, add a little exercise in there, and then you can maintain that healthy weight.
That's what I found for about 90% of people.
Interesting. Yeah. Okay, anything else that the study revealed?
I suppose it showed, I also measured people's body composition and their metabolic endpoints. So people's blood pressure, their good cholesterol, those things also stayed well under control, even though they were doing half as much. And then I track people's muscle every day in my clinic. When people start these medicines, one of the other concerns is that people lose a little bit of muscle.
Yeah.
When people switch to the every other week format, that process stopped. So people lost like an additional 2% of their weight when they were on this reduced frequency schedule. Sure. And I found that was all fat. And
all right, keep the fitness up while you're reducing this. All right.
It is possible to not lose weight, to not lose muscle when you're on these medicines, even initially. But when people get that result, they usually tell me they have a really strong plan. Like they're going to the gym every day, going to a high intensity class, something like that.
All right. Doctor, where can people learn more?
They can go to the Scripps Health website. I have a bio page on there.
Awesome. Thanks for coming in. Appreciate your time.